Hi, welcome everyone. We appreciate your time for being here. While we get started this morning, we're actually going to share with you a pretty quick activity called a Jamboard. I just plugged the link into the chat, and Carl is going to be sharing the screen to kind of show you what it looks like. So we have this engaging question for you where we want to ask you, where do you see the biggest need for equity-centered approaches to community-based caregivers such as CHWs? So when you click on this link, there's these lovely little tools on the left-hand side. And the biggest one that you could use is the Post-it that's found in the middle. It looks like a little square with some text in it. And when you pull that up, you can actually type in an answer as a sticky note. And so Carl can just put like, whatever, yeah. And you can change the color if you want, but you'll see that it just sticks a nice little sticky note in there that can be dragged around. So we hope that you can click into that link that I plugged into the chat for everyone. And start to answer that question in the background, and we can kind of touch on it throughout the course or later during the session. So again, please engage with us in the Jamboard and let us know where you see the biggest need for equity-centered approaches for community-based caregivers, such as community health workers or yourself, whatever title that may be. And we'll keep checking on that. So again, please feel free to access the Jamboard. I'm going to put the link one more time.
Hola.
Yes. Hi.
This is Miguel, interpreter. Just wanted to make sure people can hear me.
Yes, we can hear you. Thank you, Miguel.
Oh, you're welcome. Thank you.
Perfect. All right. So while people are plugging into that, I think we can just go ahead and get started with our presentation and give Carl a minute to transition. Thank you so much. So I am Ashley Rodriguez, and I'm just one of the three of our representatives today on the Community-Based Workforce Alliance. So again, welcome to the Caregiver Summit and to our session. Next slide, please. So the COVID-19 pandemic has really placed a spotlight on systemic racism and stark inequalities in the U.S. healthcare system for all underserved populations. You'll note that with these figures that are here, whereas Blacks and Hispanics represent 13% and 18% of the population, respectively, they have constituted about 26% and 30% of all of the U.S. COVID-19 cases. And nationwide, Black people are dying at 2.5 times the rate of white people. And this is from the COVID racial data tracker, which is easily accessible for anyone to access. When we're seeing all of this stark information, it's not that we didn't know, right? But the pandemic itself highlighted a lot of these challenges and issues that we already knew existed, these stark inequities and inequalities in the U.S. healthcare system. And so local health departments and other community health stakeholders really found out quickly that they had to figure out what to do for COVID-19 response and how to revamp and approach their strategies a little differently. Next slide. So because it has highlighted all of these, a lot of folks were asking themselves, what would be the solution here? And one apparent solution for all partners that had the capacity to address the response efforts that emerged are that local health departments, and not them alone, but all the other partners as well, must engage the necessary channels to center and advance racial equity across all facets of COVID-19 response strategies. And so many have called for engagement with community health workers to address the COVID-19 health inequities during the pandemic and beyond. And the term community health worker is really an umbrella term for a variety of occupations that include promotoras de salud, community health representatives, patient navigators, and lay health advisors, some of which are listed on this image here that's on the right representing the term, and I myself am also a community health worker, just for reference. Next slide, please. So this little snapshot of who we are and kind of what we do really helps you to understand that while community health workers serve nearly every sector and represent a variety of linguistic, racial, ethnic, and geographic communities throughout the United States, we are all, in the words of the American Public Health Association, essential frontline public health workers who are trusted members and/or who have an unusually close understanding of the communities that we or they serve. So often we provide critical outreach services, conduct community-based education, meeting populations that we serve really where they are, whether we're talking about physically, mentally, emotionally, and we provide informal counseling and social support. We help to address social isolation and ultimately provide advocacy for health and social issues that communities are experiencing, whether it's on an individual basis or for the community as a whole. So many of you that are caregivers or maybe are unfamiliar with the term community health worker may find yourself thinking, that sounds like me. And you're probably right. You may also be a community health worker without the, quote, official title. And so honestly, I encourage you to learn more in this journey with us about who community health workers are, how we build those trusted relationships, how we address social needs and that resource connection with communities, and sometimes provide just outright peer support. Many of you are already doing that as caregivers. You're providing that socialization, maybe in forms of education, you're addressing chronic health needs. There's a whole wide array of services that fall under this umbrella term. Next slide, please. So it's important to note that the role of community health workers is not new, even though it's maybe a hot ticket item and you're hearing it more in public health arenas and in healthcare. This is just a brief global history that's dating back to the 17th century that we're sharing with you on this slide. The barefoot doctors in the 60s that conducted outreach in rural parts of China and also in Latin America that were conducting education and outreach through community and faith-based organizations. It's been documented as early as the 60s, but we know it probably goes back much farther than that. And in the US, more formal programs that are documented as early as the 50s really show the connection between health and communities. And we begin to see that clinical and social linkages of our role emerge. Next slide. And so for the sake of advancing health equity, which is what we're predominantly talking about today, and getting back into how local health departments can engage community health workers whenever possible for their COVID-19 response, these activities involve a direct interface between the health department, community members, and other social services and community-based organizations that are especially in need of this type of engagement. So utilizing the unique lived experiences, trusting community relationships, and the skill set that's used to navigate these siloed services and systems of care and the continuum of care, community health workers are well equipped to lead all manner of COVID-19 response activities, including but not limited to these that are listed on the left-hand side, which are cultural mediation among individuals, communities, and again, the health and social service systems, building individual and community capacity, providing culturally appropriate health education and information, care coordination, sometimes case management and systems navigation, as well as advocating for, again, individuals and communities. And then sometimes also conducting that additional outreach. And so some of the other additional roles, the colorful side on the right-hand side of the slide, was also identified by the C3 project, which if you're not familiar, is around community health worker capacity. And I highly encourage you to look them up. I may plug in the chat here in just a minute. They've got some great information. That's really around providing coaching, social support, providing that direct service to the communities that they're serving, implementing individual and community assessments. Oftentimes, community health workers like myself are doing this on a volunteer basis, even if we have a full-time paid position. Conducting community assessments really helps us to keep that pulse on our communities that we serve, understanding what the needs are, going beyond just kind of a checkbox, if you will, of if this is applicable, yes or no, and what that threshold might look like if we're using Likert scales. And then oftentimes also participating in the evaluation and the research that comes out of those assessments. And so all of these roles should be, again, engaging not only for the sake of COVID-19 response, but any rebuilding efforts, any type of public health outreach that can really impact community. Next slide, please. I know I'm probably going faster than I should. So while arguably several local health departments and other community-based organizations and healthcare systems are already engaging community health workers in their response activities or outreach efforts. It's often limited to the activity of contact tracing, including some of these exemplar models. And according to a national poll that was conducted by the National Association of Community Health Workers, also known as NACHWA, this survey revealed that instead of mobilizing CHWs in the first few months of the pandemic, employers and states ended up opting to lay them off, which is super unfortunate because as a community health worker, I've definitely seen firsthand with my own eyes how vulnerable communities can benefit from our services and our linkages. And we really need to focus on that renewed effort to engage this critical workforce, which arguably is now happening nationally thanks to efforts of partners that are shown here. And so although we're pushing for re-engaging for the sake of response-related activities or otherwise, this is still just an effective tool to a means to an end, right? So local health departments, the community-based organizations, healthcare systems should really properly identify those existing community health workers, those community health worker networks that are probably already within their states and are already building those partnerships, and looking to them as the leaders of this work within the realm of community health. And I was trying to look into where we're at with our Jamboard. I don't actually see anyone plugging in yet because I wanted to go back to it and touch on some of the comments. So I think I'm going to plug it in just one more time for good measure in case people join delayed. I know that Zoom does not.
We need access to it. Can you change the settings for the Jamboard so that we can access it? Because right now we have to request access.
Oh, thank you for that. I thought that we had already opened it. I can definitely do that in real time. This is the world that we live in, right? Give me 1 second. I apologize. Now it is anyone with the link. That explains why we didn't have anyone plugging in. I apologize. So again, now it should be live, and I'm going to plug it into the chat one more time. And now everyone should be able to access that Jamboard to answer our question about where do you see the biggest need for equity-centered approaches to community-based caregivers such as yourself, or if you're a community health worker. And then hopefully we can touch on that again here shortly. Apologies again, I love technology glitches in real time. And now, unfortunately, because I may or may not have rushed through that a little bit, but hopefully it'll give us more time for dialogue, I'm going to turn it over to my colleague, Carl.
Okay, now I'm unmuted. Hello, everyone. It's so great to be here and present today. As you may have read from the description of this session, myself, Ashley, and Alex come from the Community-Based Workforce Alliance, and so I wanted to touch upon a little bit who the CWA is before jumping into the playbook itself. And so, as you all know, especially towards the beginning of the pandemic, the US was surging in a lot of different community-located efforts to respond to the pandemic, whether it be contact tracing or testing, but often missing out on opportunities, key opportunities to engage members of the community-based workforce. And so back in May of last year, several organizations with a history of working and advocating for the community-based workforce got together to form an alliance. And we had the mission then, as we do now, to ensure that COVID-19 response and rebuild efforts are equitable, effective, and involve, fund, strengthen, and elevate trusted community-based workers. And we'll put in the link in the chat to our website. So one of the kind of key organizing forces for the Alliance is a set of principles first developed by Health Begins for a community-based response to COVID, and that includes recruiting with a racial equity framework, investing in trusted workers, including CHWs, obviously a big part of the presentation we have for you today, strengthening connections to psychosocial services, launching a community-based jobs program, embedding job training, and strengthening community infrastructure and financing. These principles have been signed off by numerous organizations, not just those in the Alliance. We can also put a link in the chats for those principles as well. So yeah, one of the big products that we've developed as an Alliance, and obviously what we're all gathered here today for is this playbook. Playbook for advancing COVID-19 CHW engagement rather and COVID-19 response strategies. And so just to give you a little bit of the background on the playbook before jumping into the details, it was developed through an iterative process with a lot of folks within the Alliance, as well as a couple organizations outside the Alliance. And it really had two main goals, both to facilitate the conceptualization and operationalization of CHW engagement to advance health equity throughout all COVID-19 response activities. And to kind of parallel both of those roles, so the conceptualization and operationalization, there are two major parts to the framework, to the playbook rather. The first part, part one, is a framework we've developed for engagement of CHWs across 10 key areas, which we'll identify in a moment. And then part two, really how to make things practical, how to operationalize this engagement. So strategic recommendations for advancing within that framework. And just to say, to give credit where credit is due, a lot of the structure for this playbook was borrowed from the updated program functionality matrix that was developed by CHW AIM in partnership with a lot of organizations you see there, whether it be CHW Central, USAID, UNICEF, etc. So essentially we took this framework and adapted it both to the context of the United States and also the specific context of the COVID-19 pandemic. And so I wanted to share a quick video actually that does a little bit more of justifying the kind of original inspiration for the playbook and what it's all about before we get into the nitty-gritty. So I'll share my screen and we'll play this for you all.
Absolutely believe that public health departments are trying to do their very best, and community health workers can really be allies to public health departments in this fight.
We're like the bridge that can connect both the health providers and the communities with resources.
We're like that drop of water that keeps landing on the rock until it makes a hole. We're like that. We're consistent. So by us being consistent, the community gets to trust us more. And they know that if they need something, we're here for them.
We are able to get connected with the community. And there are people out there who are struggling prior to COVID and now with COVID.
If I'm a local public health department and I'm thinking, how do I build a workforce that's capable of responding to COVID, but who can also address the root cause issues that cause chronic disease or the opiate crisis? That's who community health workers really are.
We're in the middle where we can just speak to both sides and explain in detail and hopefully get them to understand each other and come together in the community members receive the care and services they need and they should receive, and the health providers are able to receive more knowledge about how to treat these communities.
We've put out a new document, a playbook that we think will be useful for public and private institutions that are interested in more authentic community engagement, specifically leveraging the roles, capacities, and expertise of community health workers. It's called Advancing CHWs and COVID-19 Response Strategies, or also known as the Playbook. The National Association was proud to partner with the Community-Based Workforce Alliance. This playbook is important for you to provide you guidance on how to conceptualize and operationalize CHW engagement in your COVID-19 response. The Community-Based Workforce Alliance is proud to endorse this playbook, and I'm encouraging each of you to consider it to drive health equity, to drive more authentic community engagement, and to really promote sustainability in your COVID-19 response strategy through partnerships with community health workers and our networks, associations, and coalitions. Thanks so much for your time.
Visit the website below to access the playbook and to learn more about the Community-Based Workforce Alliance.
Okay. Great. I hope you enjoyed that video. You can also put a link in the chat as well to share it with others. And that YouTube link also has a link to our player book, so it's easy to share around. Yeah, so to dive into some of the more details of the playbook itself, I'd mentioned it focuses on 10 key areas of engagement, and I won't discuss every single one of these right now, but you see them here in front of you. And again, we hope these were designed and selected to be as comprehensive as possible. So not just touch on one aspect of what it means to engage a community health worker or a community health worker association, but really looking at several different dimensions, whether it's supervision, compensation, program evaluation, et cetera. And for each of the different key activities you saw mentioned there, like I mentioned before, there are two big parts to the playbook. So this first one, part one, is a framework for engagement. And so we put together this framework as a continuum, as we recognize that not every, whether it be local health departments, health system, other potential CHW employers are automatically going to be robustly engaging CHWs, but that there is a continuum. And part of the role of this playbook is to help people understand both where they are at in the continuum and to usher them forward. And so we have for each different key activity, key area of engagement rather, a set of components that we think describe what limited or harmful CHW engagement looks like, a set of activities or components that describes what moderate CHW engagement, and then of course, at the most robust level, what does CHW engagement look across all these different areas. And really what the kind of vision we have there is of CHWs not just being, just an employer or employee rather of an organization that's contracted out, but really a key partner, a professional partner in the work of community health equity. So just to reiterate, the part one, our framework goes through the components of each of these key areas across this continuum. And then part two discusses very practical strategic recommendations for advancing along that continuum. And so just to give a kind of visual display of how they look like in the playbook, we have here part one on the left. And so this is for role definition. You see a couple bullet points for limited or harmful, moderate, and then ultimately robust engagement. And then the same thing for here, part two, strategic recommendations. And this is focused on role definition. And again, we have a couple of strategic recommendations for advancing from limited or harmful to moderate, then moderate to robust. And I know one of the key learning objectives of this presentation was to learn about how oppressive practices have made it difficult to advance health equity around caregivers and specifically here, community-based caregivers such as CHWs. And we just wanted to highlight that that is a big component of our playbook, especially insofar as we really were thoughtful about identifying what are some of the ways that engaging CHWs can actually be harmful to them. And so again, we have a set of ideas and set of notes to be prepared for each of these areas that are within the playbook. But just to voice over for a little bit, what that can look like for role definition and supervision. So see here as one example, harmful engagement means CHWs are not relied upon to design the roles and expectations within the COVID response strategy. And because they're not relied upon, there's a fundamental kind of misunderstanding of what a CHW is capable of, who they are, what kind of autonomy they should have, what kind of flexibility they should have, the scope of work. And really the answer there to advance equity in the relationship is to, of course, center them within role definition. And so you see here under robust engagement, this last bullet point, or the second to last bullet point rather, the role of CHWs is flexible enough to provide tailored support across a range of services depending on different client needs. Or the first bullet point, the roles and capacity of CHWs are explicitly recognized by other members of the community COVID-19 response strategy. So there's a healthy recognition of who a CHW is, what they're capable of by all members of the response team. And then for supervision, the last bullet point there, supervisors don't have the optimal background either they don't come from the community, they're not experienced working with community health workers. And so again, they don't necessarily understand who they are, what they're capable of. And so the very first bullet point we have listed for robust engagement as a solution is, they're both dedicated exclusively to CHWs, and they also receive training on effectively supporting CHWs. And perhaps the best solution is if a supervisor is a CHW themselves or has been one in the past. So to speak a little bit about how to exactly use this playbook, it's a big document, lots of pages, lots of text. We wanted to pack a lot in there to really kind of capture the collective wisdom within the Alliance of how to best engage CHWs, but it can definitely be a little easy to get lost. And so there are two basic steps as we see, this actually being applied in whether it be local health departments, community health centers, et cetera. So step one, borrowing from part one, the framework, and identifying where one currently exists on the continuum and then where you'd like to be. Again, this is a recognition that not everyone is automatically or already on robust engagement, especially not across all the different key activities we've identified in the playbook, but perhaps there are some where they're already there, others where, for instance, as you see here for role definition, perhaps the current position is actually a kind of harmful engagement, but with the resources and capacity that the organization has, they at least want to advance to moderate engagement. So then you can move over to part two, which is considering what kind of strategic options or strategic recommendations exist to move from where you're at to where you'd like to be. And so just as a kind of illustrative example, we have this circled here to represent where you'd find the different recommendations for moving from limited or harmful to moderate engagement for role definition. And again, like I said, the playbook itself is quite big. There's a lot of text in it, a lot of different resources. For folks, who want a simpler document, a little bit quicker, a little easier to scan and send off to folks, we've also put together this one-page summary document, which for each of the areas of engagement, we highlight the items that we believe are truly necessary for engagement, and then one or two strategies we believe exist to advance engagement. And so we can also share this in this chat. We hope it's a bit more feasible to share with folks, perhaps as a kind of an introduction to the playbook, an introduction to working with CHWs before the full playbook is put into use. So I'll actually now turn it over to Alex, my colleague, who will talk about where you could potentially use the playbook and also give a couple examples about how he's used the playbook to advance CHW engagement in his own organization. Alex?
Thank you, Carol. Hi, everyone. Can you hear me well? Yeah.
Yep.
Yes. Okay, good. Happy to be here this morning, and then I'm happy to share my experience as a local nonprofit. I lead a nonprofit organization in California. We have been using community health workers promoters for many years. So I want to try to today explain how I use this playbook in my own organization, but also within my partners, and expanding to other levels in my own county and region to engage people in how to use community health workers and also how to use this playbook. So let's start within my entity. So as soon as I'm being part of the Alliance, and then I was part of the process getting of the playbook, but that even through that process helped me to develop my own structure in how to use the CHWs, all of the 10 areas of work, develop my own agency in order to improve and to see how I can improve. So that's one of the uses that I was able to put in practice within my agency. So I developed this kind of training with all of my leadership staff, with the community health workers. We review it, we redefine, we evaluate ourselves in which level we are. So it was very helpful to use it in our own agency. But also one of the areas that we was able to use it was trying to invite, especially with COVID, invite especially the public health leaders, the departments to start having the conversation. So that was the first approach with my local health leaders to have a planning meeting, and then I show this playbook as part of my approach in how we can address the COVID-19 issue in our community. So we have a lot of back and forth conversation. They review the playbook. They start understanding what is a community health worker, what they do, how they can be effective in their own community. So in that process, having the discussion and reviewing the playbook, we find out that a lot of people have some knowledge of community health workers, but not really like an extent concept. So going this through reviewing the playbook, reading the playbook, it was a way to educate in some level those that are in leadership positions to really understand and also advocate on behalf of the CHWs Promotores de Salud programs. So that's one of the aspects that I was able to use it internally, but also with my local health departments. And then at the end of the conversation, they were able to allocate some funding for community health workers addressing the pandemic after they use the playbook. In another aspect that we were able to also advocate, it was more like a region settings and state settings. It was trying to bring awareness about the importance of community health workers within other CBOs and community health clinics, whoever is doing some community work, to really invite them to consider in how to engage this community health worker approach within their own agencies. So that was another aspect that we were able to invite community-based organizations and community health clinics and invite them. So the playbook was really instrumental in having these discussions and also in developing this structure within their own agency. So I think it's very important, this playbook. Any of you from whoever entity you are working with, you can review it. You can see, okay, this is really like all of the CHW aspects is here in this playbook, and then you can consider if you want to use it. And that's what happened with a few agencies locally. One of them, it was a local clinic, and another one was a community-based organization which we partner with, and we have the discussion about community health workers, and they use this playbook to really start implementing their own CHWs within their own agency. I think that's very important, that anyone can use it, and also the uses. So this is this is kind of a process for survey, planning and review, assessment, improvement, and capacity building. So I think that's how the playbook can be used, like compare CHWs and identify the gaps, and also develop a planning in how to enhance the areas that may need to work in, like we did it in our own agency. After reviewing the playbook, we define, okay, there are 3 or 4 hours that we need to start working on and enhancing our own capacity on our agency. And then developing kind of this structure of like all of the aspects that we mentioned, also that help to really make sure that we cover all of the areas in order to have a successful CHW program. So I think in anyone who really are doing community-based work should be considering to use this playbook in order to see if they can embrace the community health worker approach, and identifying if they can put it in a practice. So I think this is very much on my part, trying to share my own experience, how I use this playbook within my agency, with my partners, with local leaders, and right now showing a case that this is really working. One of my friends started using community health workers after the playbook was presented. He was kind of he just mentioned a few weeks ago, Alex, thank you for the playbook. That's been really my map in how to do this work. So I think it's very unique tool that anyone can use and consider to using it. So that's one of the areas that we want to share. You can go to the next one, to the next slide. This is just a list of people has been using it or are using it. There are some names there, and then I think the list can go over. But there are people that has been expressing that they have used the playbook and has been really showing success in the use of the playbook. So I invite you to consider. We are here to see if you have any questions after that. So I send it back. I turn it back to Carl so he can take over.
Thank you so much, Alex. I will actually stop the PowerPoint and return back to our Jamboard that now has a lot of responses. And I'll also turn the mic back over to Ashley to help us understand what folks are saying here.
Yeah, definitely. I'm so glad that this is working for folks. I'm again, apologies that it was closed and then it was view only. So I'm glad that you're still plugging into this question. And for those of you that missed it, it is really easy to utilize the Jamboard. On the left-hand side, we've got wonderful little tools where you can grab a virtual Post-it and answer the question. So again, the question that we asked was, where do you see the biggest need for equity-centered approaches to community-based caregivers, such as community health workers, or again, other titles? And there's some really great, robust answers in here. So we've got access to benefits, PTO, salaries, et cetera, not just based on grant funding, clear on boundaries on what is within their role and what is not. Absolutely agreed. Let's see, link up academic health centers, local health departments, and community health workers to advocate for better support for community health workers. There's too many silos. Agreed. A seat at the decision-making table. We need more direct practice professionals informing policy. These are fantastic responses, and I wholeheartedly agree with you. I will say, thanks to, in part, not only some of the key national players, if you will, like the APHA Community Health Worker Section, which I have the privilege to currently chair, who's been active in this space for arguably over 30 years now, does grant that seat at the table for frontline community health worker staff and also allies. And as does NACHWA, so the National Association of Community Health Workers. And I did plug both of those in a moment ago. Definitely scroll up through the chat to read more about what all they provide and their membership. And definitely continue to plug into that. But I know we have another question for you all, and then I'll kind of touch on some of the questions that have been asked in the chat as well. So at the top of the Jamboard, you'll see that Carl is toggling between two slides. Probably just scroll up one more time so you'll see. So the first one is the one that you've already answered, and if you'll toggle to the second one, you'll be able to see the second question where you can also plug in and grab a lovely little Post-it, which I think Carl will demonstrate again just for good measure. But the second question we're asking you is, how else do you think that the Community-Based Workforce Alliance, which I know we had some questions about the definition of that, so I'll also share that again, could help community-based caregivers? Again, whether your title is a community health worker or not, arguably you kind of fall under that bucket for today's purposes. And I just want to verbally also kind of touch on what community-based workforce is, because we did have that question in the chat earlier and I plugged in some stuff, but not everybody is, quick to grab that. So not only do we define it on our website, some of that is, of course, while the skills and roles may vary, a community-based workforce share common experiences and traits which are tied to, that lived and shared culture, the language, life experiences with the members of communities that we serve, having earned and enjoyed that deep level of trust with your peers or your neighbors, as well as demonstrate long relational expertise and interpersonal communication skills, having demonstrated a longstanding commitment to advancing equity and health in historically marginalized or minority communities, and also aiming to promote health and racial equity for residents in a particular place, community, not necessarily just patients belonging to a particular health panel or payer type. And that's just one facet of the definition. I mean, there's a ton more to explore. And then I also got one too, as well as, you know, the scope of practice and, you know, how do you know if you're qualified, if you will. And so one of the things that I plugged in the chat as well is, again, the direct link to APHA, which defines who we are, as well as NACHWA. And depending on your state, there may be actual certification, there may be state statutes around what a community health worker can do. It really just depends on where you're at. So some states are just now starting to explore the community health worker realm and, you know, funding behind that and what that might look like in terms of certification, again, continuing education, the whole gamut of things. If you're within Texas, it is overseen by the state health department, and we do have formal certification, and we do have formal training that is recognized by the state. It really just depends on where you're at, but I would encourage you to both look at both of those entities, both APHA and NACHWA, for more information. And of course, you can also reach out to me as well. I'm happy to plug in my contact information here shortly. And then we do have a wonderful question from Igor, so I'm gonna present it to my colleagues to also touch on it. I don't want to be the only one speaking. So Igor asks, are we tracking the success stories and impact of the playbook use and adjusting it based on feedback? And I can start with Carl, and then I'm sure Alex can also weigh in as well.
Yeah, absolutely. That's a great question. I'll begin by saying, so the playback that we shared in the chat, the kind of most updated version, is actually an updated version that we developed after we first released the original draft back in September. And we had, you know, done a couple set of kind of informal listening sessions and, you know, informal feedback from a lot of other organizations. And we took that all into consideration and kind of revamped the presentation, revamped how we were describing the different areas of engagement, revamped the content for those areas. And so that's to say, yes, like we are updating this. We have already, and I think as we're able to speak with more folks like yourself, to consider, especially, you know, as whether the situation of COVID-19 changes or other opportunities developed that, you know, need some kind of marshaling energy around the community-based workforce, community CHWs. We would love to be able to, you know, update it accordingly. We are trying to track where this is being used. We started to have a little survey, which you guys will receive shortly, just to get a sense for your interest in sharing this playbook with folks in your network, your interest in speaking with us about how it's been shared and what that experience has been like. And so we're still in the midst of kind of collecting that information and trying to synthesize it. But absolutely, this is a learning process. It's a living document, if you will. And so if there are particular things that you want to see in it that you think right now are missing, either put into the chat for others to comment on, or feel free to email us afterwards, and we'd love to hear your take.
Thank you, Carl. Let's see, I also want to just make sure that I'm touching on some of the other key questions that were in here. And Alex, feel free also to weigh in or add anything that you haven't already spoken to. I mean, maybe, Alex, you can also touch on this from a California perspective about how an individual who's interested in becoming a CHW or promotora will know how they're, quote, qualified or how to get involved.
Thank you, Ashley. I think this is a lot of discussion about it, but I think one of the things that we are, as the CHWs, they have, we try to find people who has really those qualities, the heart to serve the community. Someone said, we recruit the heart, entering the brain. And that's what we look when we are recruiting CHWs to do the work. That those qualities from serving the community and and really taking care of their own community. So in California, we there are a lot of agencies working on CHWs, from community-based organizations and even to county and community health clinics, people working in hospitals. So I think that's the entire spectrum of the roles of the CHWs, from community organizing to really working in clinics. So I think that spectrum of roles has been expanded through the years in California. So I think one of the things, the recruitment is very important, and also after you do the recruitment is the training part. So there are a few agencies like El Sol and other agencies that in our region that provide training to the CHWs and also to work in their community or clinic. There is no certification in California yet. And then we have been back and forward with the discussion, because we think a certification could be limit some of those community health workers that really are really well known in the community and effective. So I think that's a lot of back and forward. I think we are moving towards certifying the training entities, things like that. But that's how we are right now. There are a few networks in the region of community health workers that are really doing a great job as well.
Thank you, Alex. I'm not sure that I'm really seeing any other questions in the chat, although we can arguably continue to share the Jamboard responses. I think that we're still open if you have other questions that we haven't touched on to get you to better understand the community-based workforce, the Alliance itself, our playbook, or more information about community health workers for your state. So I'll just kind of scroll through and make sure I didn't miss anything. Again, I don't think I've seen much more plugged in. And I'm just going to ask my fellow moderator, Michelle, have you seen anything that I might have missed that came through? Oh, good. I'm seeing a couple
I just
others.
sent you one from Jacqueline about defining racial equity, and if others on the call have thoughts on that.
Yeah, great question. Definitely start with my colleagues, and then happy to also weigh in on what that looks like from the Community-Based Workforce Alliance perspective.
Alex, do you want to take a stab there?
Sure. I think that's a big question, and everyone is working towards in these. So I think the model as community health worker is really a model of social justice and social change. So I think that's something that is behind of the CHW work, is really to bring these aspects to even when they are working in a home visit, or if they are doing a diabetes class, or if they are doing an asthma class. I think that concept of social justice is there, that generates a lot of to respond to the questions about equity and racial. So I think that they are the ones who are advocating for changes within the agency, within the system. They really bring the voice of the community has not been heard, and really trying to empower themselves and the communities to be on the table on the decision making. So I think that's been having a CHW will help in this area. I don't know, Ashley or Carl, do you want to add something else?
I think that's great. I definitely want to make sure that we're also making space for the other questions that was asked right after that one. Jacqueline had asked us, and I think Alex will also want to weigh in this as well, what are the long-term implications for community health worker career pathways? It's such a unique question, right? And arguably we all kind of come with our different experiences and lens and perspective. I would say, a lot of us that are community health workers, and and even the allies that have been in the space for a long time, we're very aware and cognizant of the fact that, again, we're kind of a hot ticket item, right? A lot of people are throwing out the term community health workers and the use and the need and the utilization. And we just want to make sure that everyone that wants to be involved in this space is coming at it, again, in the for lack of a better term, the right way. So Carl touched on, those harmful approaches, what's helpful, what's not helpful. I think that depending, again, on where you're at, where your state is, where the organizations or healthcare systems that are supporting your communities are, it's going to look a little different everywhere. In Texas, because we've had formal certification since 2009, so over a decade now, and there is state legislature behind that, and we have 4,000 community health workers at any given time across the state. Many of which, I want to say the percentage for, and don't quote me on this even though it's being recorded, is probably around 60% are full-time employed, so they're not just volunteer roles. We're fortunate enough to have career pathways here. My full-time employer, Baylor Scott & White Health, employs 112 community health workers, 80 of which are full-time staff. And we do have an actual career path. We have 7 different job descriptions. So it's not just community health worker. We have an in-training role, we have a 1, we have a 2, we have a supervisor, we have a manager, we even have a consultant role. So, hopefully more health systems and local health departments and other community-based organizations and government agencies are going to recognize that we do need to build stronger pathways and stronger career paths for community-based the community-based workforce and community health workers, but I'll let Alex also touch on that.
Sure. Thank you, Ashley. I think regarding the pathways of the career development in our agency, we have around 60, 70 full-time CHWs, but we create kind of these how can I say, growth in terms of the roles. So, for example, I have CHWs, basic CHWs, and then we have advanced CHWs. They have other skills that they, and also they other roles as well. And also we have a team leader positions, and also we have a supervisor or coordination effort. But they develop their own path, wherever they want to go. And then I know there are some CHWs that really want to pursue other career, which is great too. That they can really incorporate CHW in that careers if they are going to social work or whatever, and also when we do kind of training to CHWs and CBOs on these, that's the main question, and also sustainability is part of the career pathway. It gets aligned in order to say, okay, how I can grow in this area in terms of career, but also like pay scale, and that got aligns with the sustainability questions.
Thank you, Alex. We did get another question in the chat, and then we'll turn it over to our Jamboard. So I want to touch on that as well. Forgive me, I'm not going to attempt to say your name because I might botch it. But this individual asked, where can we start? Share the playbook with higher ups at our agency. And I'll just briefly say, yeah, that's one piece of it, right? Maybe start with the smaller one-pager, which I'm going to put the link in the chat in just a moment. And yeah, just start, sharing that information about what a community-based workforce is, defining it, advocating, again, for yourself or for your fellow community-based workforce, and what that looks like. And so that's my initial take on it, but I know that Alex will have more, and then Carl may also want to share as well. And thank you for plugging that in. That's the link to the one-pager for you all to grab.
Do you want to go, Carl, or you want me to go?
You can go for it.
Okay, I think one of the things is, yes, be familiar with the playbook, understanding the concept, really, so you can debrief with the higher, and then it's very important to whoever make those decisions needs to embrace the philosophy in order to implement it. But I think little by little, like implementing a small group of focus group, hey, what do you guys think about this, and having getting the existing workforce staff to say, hey, what you guys think about this, and really making a movement towards a higher level. And then also, I think it's important to do like assessment of agency readiness, how they are, at which level, at which stage of the agency are they at the moment, in order to do the change, because there needs to be some changes within the agency in order to embrace the playbook and CHWs. And to be honest, maybe some of you are doing the same work of CHWs, but you don't know they are CHWs. You know, maybe they don't have the title, but it doesn't mean that they are. So maybe they are already being there doing the work as a CHW, but many of them maybe they don't know. So I think that having that discussion, say, you know what, this is a CHW. We are really doing CHW work, which I think that can be also a part of the discovering process within your agency.
Agreed, Alex. I'm going to touch on a few of these comments in our Jamboard finally, just so people can see them and hear about them. And then I have one last question for Jacqueline, who I'm excited she's robustly engaging us today. So we also asked you, how else do you think the Community-Based Workforce Alliance could help community-based caregivers, such as community health workers? And some of the responses are increasing in visibility, normalizing a community health worker as part of a clinical team. Wholeheartedly agree. In the policy and advocacy realm, advocate for standard pay requirements. I will tell you that nationally there are a lot of these efforts going on. There's a lot of policy work, reimbursement models that are being explored, again, specific to states. We'll see what happens nationally. Also, there's a comment in here, increasing the capacity of more community-based organizations to certify CHWs. And then a majority of frontline clinicians are very unaware of the presence and benefit of a community health worker. Yes, absolutely. The advocacy work is never done. It's never over. This playbook is just one tool, right? And there was a question earlier, if I didn't touch on it, about could the playbook be used for outside of COVID-19 response? And the answer is absolutely. Take those principles and apply them to your community-based outreach, apply them to your local health department outreach, your nonprofit organization goals and efforts with communities. Definitely, it can be used outside of COVID-19 response efforts. So now Jacqueline asked, and I think we'll all probably touch on this and then we'll get cut off, I'm sure, on time. Part comment and then part question. So CHWs are oftentimes hired contractually or temporarily, as we see now with the COVID-19 response, absolutely. Although great to be employed, these types of employment often lack typical medical or other benefit packages offered to full-time employees, limiting access to care for the actual CHW. Are there advocacy or oversight efforts happening at the Community-Based Workforce Alliance to address this issue? I will say a resounding yes. There's so much going on broadly. And a lot of the key players that aren't just the three of us, we're a very small portion of the Alliance itself. And we represent 3 separate organizations. I believe there's over 27 total that are a part of the Alliance. But I want to hear, because I know Alex has some more insights on specifics, and then Carl may also want to weigh in as well.
Sure. Let me jump in quick before we end. I think we are different approaches. First of all, we are trying to influence the money that are coming from the Biden's package to really incorporate this language of really CHWs and community-based approach. So I think that's one of the advocacy part that we're trying to say, hey, let's move forward to really provide support to the CBOs to do this work. In another side, I think we have been working on trying to see how in some of the states can CHW be part of the billing from Medicare and Medicare, and then I think that's another aspect that we're working on it through our efforts. I don't know, Carl, do you want to say something?
I think we may be at time, so I would love to. Well, we will stay connected. Reach out to us, connect you with the work of the Alliance. There's a lot of work to be done. I think I'll, yeah, Keely's sharing her screen now.
Great, thanks everyone, and please join me in thanking our speakers, Alex, Ashley, and Carl. We are about to break for 30 minutes, but please take a chance to join the mindfulness movement and meditation session, and then you'll see down below are the sessions that start up at 1:40 Eastern Time, 10:40 Pacific. Policy, equity, and innovation, each of these sessions will be starting at 1:40. Thank you all so much.
Thanks, Keely.